Good afternoon. Welcome to 𝐻𝐿's Academy Reading Live, and I am Vinod James. Welcome to another lovely session, Tuesday. Hope you're all doing great. So, what are you all waiting for? Please do shoot your valid comments so that we can enhance this live lesson as always, isn't it? Because of your valid participation, every live is something very, very, very fruitful. So what are the things that 𝐻𝐿's Academy offers for you? 𝐻𝐿's Academy has an array of training we give for different, there are n number of training that we give on the aspect of different linguistic exams that you can take. So we are always happy to give and make sure that you are benefited, and we make sure that you will be benefited on the aspect of how we have scheduled our classes. Okay, so if you are joining our batch, and make sure that we will make sure that you do things as is expected. Nice, Joji. And you can see that our next batch is only from March, April, May. Till that time, we are quite full. Libby Tenny, good morning. So a very good morning, a very good afternoon, and a very good evening to all my lovely students from different parts of the world. Why different parts of the world? You name different parts of India, Nepal, Pakistan, Afghanistan, Sri Lanka, Maldives, Mauritius, Malta, different parts of UAE, Canada, Australia, New Zealand, UK, Ireland, Scotland, Italy, America. You name those countries, we have students, and of course, different parts of Africa as well. This small job, good afternoon. So nice to see all of you eagerly waiting, as we are all eager and so much enthusiastic enough to see how many of you are there and how many of you are new. So everything we are always, it's always nice. Shiny VS, good evening. Arun Ravi, good evening. Achu Nitin, good afternoon. Jismol, how am I? I'm doing good. Thank you very much, Jismol. Very sweet of you to ask me. I hope you are all doing good as well. Neetu George, good afternoon. Excellent. So all of you are doing very, very good, is it? Rajita Rajan, good afternoon. So nice to see at least one icon next to your name. That shows that you're all there, showing the immense support to the Academy, because we all believe in family. So you're all considered to be our family. So you're all there, rendering all the support as much as we could. Because no matter, Rupal Harry, good morning, sir. How am I doing? I'm doing good, Rupal. Thank you very much. And I hope you are also doing good. Just small fine, very good. Happy to hear that you're doing good. And I hope your studies are all going as it is, because I know that you do have a short break one day, and you'll have your next classes scheduled as well. Right. So what are the things that 𝐻𝐿's Academy offers for you? We have a lot of live session that we have incorporated ever since 2024. You asked for it, and we have come up with a bang from 2024. You wanted us to give you more reading session, we have complied to it. You wanted us to take listening, we have complied to it. You wanted us to give you more of speaking, we have complied to you. Sidhu, Bangalore, good afternoon. Kalei, good afternoon. Maldives, very nice to see you back. 𝗵𝐺, good afternoon. And we have just pinned the channel, social media platform that 𝐻𝐿's Academy has. If you have not yet joined, please do join. These are all free access for you, so that you will not miss any of the info that we want to bring it up for you. Okay, so good enough. So that is the only way that we expect all of you to show that you are there supporting us. I know that you're all there supporting. Even if you look into the Telegram pages, we have only 2 Telegram pages. One is the official 𝐻𝐿's Academy Telegram page, and the exclusive reading Telegram page. If you really look into, we're always there, hovering about close to 50K students. And this is only mostly it is the students who are doing the exam preparation. All the others who have cleared, of course, they're all there in their dream country. Neetu Sriraj, good evening. A lot of people from good evening, so I know where your terrain would be from. Good enough, Reha Vasapan, good afternoon. After some time, yeah, fair enough. Nimmi Mary Abraham, good afternoon. Nice to see a lot of a lot of known names along with new names as well. So that's the beauty when you come in front of live in front of you. Marriott Arun, good afternoon. So again, a new name. So if there is anybody who's attending the live for the very first time, please be kind enough to let me know that you're attending for the very first time, and also where you're from, because I love to say that I have known people across the globe. Josmi Johnson, good afternoon. Priya Vijay Kumar, good afternoon. So if you have not yet liked our page, please do click the like button. If you have not yet subscribed to our channel, please do click the subscribe button. If you have not yet clicked the follow button, please do click. That is not for any other purpose. That is for making sure that you are reached. Whatever that we want to bring into you, that is coming straight into you, onto you. Neetu Sri Raj. Sorry, sir. Good afternoon. I'm really excited to tell you thank you. Why do you have to say sorry? You don't have to say sorry at all. But I'm really excited to know, what are you saying thank you for? Okay. I got my results today and reading 400. Absolutely good enough, Neetu. So nice to hear that. 400 in reading is absolutely your hard work. So pat your back. I should be thanking you for getting that score, isn't it? So absolutely, Stunner would be happy to hear what the other scores that you've got as well. So that can be a catalyst for all my other students. This is George. Good afternoon, sir. And there I have 𝐂𝐽𝐬. I would like to express my sincere thanks to the entire Neetu's family. Today I'm here with B Band in all modules. God bless you all abundantly. Lots of love to all my teachers. Thank you very much, 𝐂𝐽𝐬. I know that you're from Maldives. We've taken all those lovely blessings, lovely greetings from all of you. It's an absolute honor to be. We have to say that we are proud enough to say that you're all our lovely students, and thank you very much for that smallest gesture, because that takes a long thing for all the other students who are in front of me, saying that okay, one day I will also come and say I have made to my dream. So two students have made to their dream. Neetu Sri Raj, who got reading 400, 𝐂𝐽𝐬, who got 4B. Excellent. So take all these congratulations for both of you. Donna, good afternoon. Reha Vasapan, congratulations. Shiny, congrats. 𝐿𝐺 congrats. Jilmi Joy, good afternoon. A very, very, very good afternoon. So nice to start the session, isn't it? Something which is like a very, very, very sweetest thing that you can hear. Soumya Anna Thomas, good afternoon. So congratulations to Neetu and 𝐂𝐽𝐬, who have been putting their effort and who have made to their dream, isn't it? That's called hard work, and it definitely reaps along with God's grace, of course. Shiny VS, congrats. 𝐂𝐽𝐬 410 speaking, 350 reading, listening 380, writing 360. Absolutely good enough. Very, very, very good. Keep it up. Thomas Casey, good afternoon. Anjunaya, congratulations. So take all these congratulations. You are absolutely in the limelight. Okay, and this is what families are for, because your success we also cherish. So good enough, good enough. Korean Thomas, good morning. Very good, very good. So what else could I ask for, isn't it? To start the session with a lovely positive or a catalyst to each one of you. Neetu Sri Raj is saying thank you so much for all of you. Soumya is saying thank you. I'm sorry, congratulations. Good enough, good enough. So yes, so as let the firecrackers, and congratulations to all those who passed. Thank you very much, 𝐂𝐽𝐬. Very sweet of you to give that sweetest gesture to all the people who have made it to their dream. Good. So as we have started with the firecracker, isn't it? So what else could I ask for? A big bang on the entry of today's session, with a lot of people saying I have made to my dream with some stunning scores, isn't it? 410 speaking, 400 reading. Absolutely good enough. So barring that, are you all ready for today's session? Yes, if so, give me a very quick thumbs up saying that I am ready. Like, just put a thumbs up or say yes. Anything. Let me see how many of you are ready. All right, I can see a few thumbs up popping up. Are you all ready for today's session? Just small 𝐿𝐺 is ready. Good enough. Good, good, good. Now what we'll be doing a part B initially, and then we'll be discussing the part A. Soumya is ready, Arun Ravi is ready. Good enough, good enough. So part B, the question will be popping up on the screen, and do not waste your valuable time. As soon as the question pops up, just do the material. Okay, try to complete it on or before time and just put a sign saying thumbs up or done. Reha Vasupan ready, Kalay ready, Atira Sally, good afternoon, Shiny ready, 𝐿𝐴, good afternoon, Naisha ready. Alright, as you all have said ready, the material will be popping up on the screen. Do the material and then we will discuss. Alright. There you have the material. Please do and then we will discuss. Alright, the time I've just alluded. So Neetu George is the first one to say done. Good enough. 𝐿𝐴 said ready. Alright. So I hope all of you have an answer before the clock. I've just stopped on you. Kalyani Rajagopal, yes. Jismol done. Good enough, good enough. Achu Nitin done. Good. Thomas Casey done. Good enough. Sidhu done. Naisha done. Okay, good enough. Right, because you have all said done. I'm not saying all of you have said, but whoever. I always believe that a person who is here to start commenting, that takes a challenge, isn't it? It takes a lot of pride to come and say, see, I'm here with the purpose. My purpose is to say, okay, whatever it is, done. Whatever is my answer, I'm going to shoot my answer. Good enough, 𝐿𝐴 done, Shiny done, Najee Thomas done. Good enough. Now, would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important because we always believe in correcting from where. If you would have gone wrong, it's our job to correct you. Okay, Jilmi done. Good enough. So please be kind enough to let me know what is your answer and where you got that answer from. Neetu George, B from the first sentence. Okay, fair enough. So my first answer is B. Second answer is C from the second para. That is Sidhu. Rasna Suraj, good afternoon. Good enough. So B and C are the two options that I have already with the two people who have already commented. Just more is saying B from first part of the para. Fair enough. Savit is saying C from first para. Okay. So this is what the diversity is, isn't it? The same place, two answers are a possibility. Good enough. Savit is saying C from first para. Kalyani is saying C. Reshma is saying B from first sentence. Thomas is saying C from first para. Naisha, B from middle. 𝐿𝐴, B. Okay, fair enough. Let's see. 𝐿𝐴, C from first part. Okay, first para. Marriott Arun. C. New name as I mentioned. Anu Ravindran. C. Okay. C is picking up, is it? Linisiju, C, first para. Lindsay, Lijo, B, first para. Achunitine, am I happy? A, B, C are a possibility, isn't it? So you have to always understand all the three answers can be a possibility. Okay, because they have framed it as such. If you don't really look into certain aspects, all the answers can come in front of you. Saumyana B, Rasna Suraj C, Beulah Ratna C first para, okay, fair enough. Arun Ravi A first para, okay, fair enough. Shiny VS A, all right. Now I've got few answers. Now the material will be coming back on the screen. Now what are the things that you have to be very cautious when you're doing part B? Part B, the question type is called multiple choice question where you are given three options. Okay, so the way that you're going to find the answer is called elimination method. That's a strategy. Gigi Albin, A from first para. Okay, fair enough. After that, you always should understand part B. You're going to read the question. As you read the question, underline the keywords of the question, understand the question. Three important things that you have to do. Read the question. As you read, underline the keywords of the question, understand the question. Keywords should not go more than 2 to 3 words, both in the question as well as in the answer option. Now see, the memo says, failure to screen a patient for malnutrition may result in. So when you are not screening a patient for malnutrition may result in. So they are expecting you to find something. Okay, and when you're doing part B, read along with the question, the answer option. Malnutrition may result in a change in overall health. Malnutrition may result in a prolonged stay at the care facility. Malnutrition may result in care providers being unaware of an issue. So this is a memo. You have to always understand. Okay, memo to whom? Hospital staff, and it is about nutrition screening. Now read. This is to remind staff of the importance of nutrition screening to identify problems which may go unrecognized. So, slightly pointing into C, let's see, and therefore remain untreated during the patient's hospital stay. So again, slightly pointing into C. Okay, now, nutrition screening should occur on admission and then weekly during the patient's episode of care, at least monthly in slower stream facilities, or if patient's clinical condition changes. So they're saying, okay, when you should be screening the patient. All patients should have their weight height documented on admission, and weight should continue to be recorded at least weekly. Patient whose scores is at risk on a validated screening tool, whose clinical conditions is such their treating team identifies them as at risk of malnutrition, should be referred to a dietitian for a full nutrition assessment and nutrition support as appropriate. Okay, fair enough. Now let's go and see the elimination method. A change in the overall health. If the patient is failed for screening malnutrition, a change in overall health is a straight eliminator because it is nowhere mentioned. Okay, if they are not screened, the question should be understood, not what you are referring to. See, you're trying to find an answer. Okay, keyword reference, not keyword reference. You should understand the question and to the question. If they fail to check for malnutrition in a patient may result in. So what happens to the patient is a question. A change in overall health, where is the thing? It is not saying that they have a change in their overall health. They are saying patients who are at risk, already at risk on a validated screening, not because they failed to that test. So this is eliminated. A prolonged stay at care facility, where are they saying? They are saying if they are at risk, they should be referred to a dietitian for nutritional assessment and nutrition support. Even in the first part of the paragraph, they are not saying that they should be staying at the hospital for a longer period of time. They are saying this is to remind the importance of nutritional screening. Why? To identify problems which may go unrecognized. So that is the problem. The provider cannot be giving care if they are unaware of the issue, isn't it? and remain untreated. That's all what they're saying. Okay, so B is also eliminated. So congratulations for all the students who have got C, because C is the right answer. And it's a very straight thing. You get that from first sentence, although the whole paragraph is talking about C. Any doubts? Please do clarify. If not, please do let me know. I'll be happy to assist you. Are you clear with what I have told you? Because you are trying to relate it with something which is C. No, you have to relate it to the question. If they don't screen a patient for malnutrition, what will happen is a question. 𝐿 is dancing, yeah, good enough, keep it up. 𝐿𝐴𝐻 clear, 𝐿𝐴𝐻 dancing, good enough. 𝐾𝐭𝐬𝐽 happy. 𝐿𝐴𝐻 clear, 𝐿𝐴𝐻 clear, good enough, good enough. Any doubts? Please do clarify. If there is any doubt, you're always welcome to shoot your question. If not, we'll go to the next thing. The next thing is we're going to talk about part A. Any doubts before I end up starting part A? Anything that you want me to clarify? And anyway, today's part A is called mucormycosis. Soumya clear, Juby clear. Okay, fair enough. So mucormycosis is what today's material is. So I've read what is today's material. I want you to let me know how you felt about today's material and how many minutes you took to complete today's part A. Because our challenge was to make sure that all of you clear on 8 minutes. So tell me. Soumyana, clear, okay, fair enough. Easy topic, Reshma, 14 minutes, okay, fair enough. So the first review I have got from Reshma who's saying easy topic, 14 minutes. This small tricky material, 13 minutes, okay, fair enough. So easy, tricky, 14, 13. How about others? Arun Ravi, 14 minutes. Okay, fair enough. Kalyani is saying little bit tricky, 14 minutes. Okay, fair enough. Savit is saying tough, but 13 minutes, good enough. How about others? See, do not refrain yourself. I wouldn't say all of you, because there are fraudulent people sitting in front of us. I would say students who are here with a purpose. I want all of you to comment. Why that purpose? Okay, see, your job is to comment. It's not about what others think. Oh my God, I got wrong. See, if you have got it wrong, it's our job to correct you. If you've got it right, it's our job to congratulate you. So either way, you are benefited. So please understand that. Kalai, easy, 12 minutes, absolutely good enough. I like your attitude. Even though, like you just got your results, but still you have done that material and entered, isn't it? So absolutely hats off to you. Good enough. Now I've got an easy understanding on the aspect. It varies, okay? The same material, students are saying easy, tricky, tough, all those things, little bit tricky. So let's see how it is. And the material will be popping up on the screen and then we will discuss. So part A starts with reading, okay? The reading starts with part A. Sorry, I just put the other way around. So part A, the material will be placed in front of you and they will give you 15 minutes only. And in that 15 minutes, you are expected to write the answers. Okay, so what is the strategy? So strategy is called skimming and scanning. Okay, so Reshma is also saying congratulations to Kalai. So scanning, I know that you're very much aware of it. You're going to look in detail. Skimming means you're going to quick read it or have a quick look. So you will have 4 texts and based on one common theme. Okay, now this common theme today is mucormycosis. So each text will be different to each other. How are you going to skim? I've always told you the importance of skimming. So always remember, do not underline big sentences like this. This is not skimming. Okay, skimming should be keywords. So you are only expected to underline the words that you feel that those are the keywords. See, it is not necessary that all the words that you underline can be or should be the keyword. Randomly, when you know there is a criteria which we have already discussed, please do refer the previous audio, or there is one exclusive video that we have done in the very same page that you're watching where you have the insight of What are the things that you have to underline in part A? I'm just going to show you how to skim. So mucormycosis is a type of fungal infection. It's relatively rare but very serious form of 𝐲𝐶𝐵Hy, and it's a weakened immunity and the illness and health condition. People who are under diabetes mellitus and have low levels of neutrophils, where white blood cell fight and infection will heal itself, and neutropenia, and the people who have immune system, it's medication, immunosuppression, part of the medical hematology, malignancy, hematopoietic stem cells transplantation. Solid are the victims of micro caused by the exposure to micromycete molds and the organism leaves, piles, soil, rotting wood. You can contract micromycete by breathing mold spores in the air. This is referred to as sinus of pulmonary exposure. The fungus can infect a cut or wound and it's spontaneous and it's a infection. Done. So roughly about 15 seconds I took. That's what you take, even though they say 1 to 2 minutes. But I would say 15 seconds each. Likewise, you go through each text. So this is all about diagnosis. So there are talking about punch biopsy, histological examination, CT or MRI. Likewise, you have to go through it. The text C is about treatment. So standard therapy, experimental therapy, physical rehabilitation. So anything which is related to treatment, go to C. Likewise, you should differentiate. D, again, it's about a study of post-COVID and nasal, fungal hyphae. Likewise. Then go to the question. So you will have 20 questions, 15 minutes, and these 20 questions are divided into 3 types. These 3 types of question along with their question numbers and the instructions should be by hearted by all of you. That gives you a lot of time saving. Okay, 1 to 7, these type of questions are called match the following question, where the instruction clearly says you are only expected to write any of these letters A, B, C, D, and you may use any of these letters more than once. So if your skimming is proper, that means if you have underlined the right words, you can easily refer to the answer. See, for example, advanced techniques to identify rhinocerebral mucormycosis. So rhinocerebral is mentioned in B. So they are saying diagnosis. So here, advanced technique. That is it. I'm not going to even refer because this is the only place where I know this word is there. Likewise, predisposing factors of mucormycosis. So predisposing means susceptible. So what are they susceptible? They are already talking about these people are susceptible, isn't it? So mucormycosis are caused to the exposure of these other things. Again, straight, easy answers. Now, why do zygomycosis survivors need occupational therapists? That means why do they need their help? So they are talking about something in C, isn't it? Because treatment. Why? Because they're saying in many instances these patients need prolonged courses of physical or occupational therapist rehabilitation depending on the degree of disability. So that's why I said it is there in C. Procedure done for patient presumed to have mucormycosis. So presume means assumed, who are susceptible, suspected. So where are they talking about all these? It should be there in the study of a group, isn't it? So they are saying mucormycosis susceptible patient. So definitely D. See, the cumulative count of patient accessible for flow data. Again, do you really need to think of it? The cumulative data, where are they talking about the patient? Study in a group is done in D. So write D. Formidable choice for the treatment of invasive zygomycosis. So formidable causes which medication? So definitely treatment is where? C. Now, are they saying about? Yes, it continues to play as a major role in invasive zygomycosis. This is called keyword reference. Mode of transmission for mucormycete molds by be characterized. So how are they characterizing? It is definitely in A, isn't it? So they are saying any exposure, they are saying pulmonary. If it is cut, it is cutaneous. So that's it. So easy by referring keywords. So 8 to 14, these type of questions are called short answer question, where the instruction clearly says it can be a word, short phrase, which means anything between 2 to 3 words, number or numbers, or both. That means word and a number. Jismol is happy, 7 out of 7. Very good. Reshma 6. Good. Kalei 7, absolutely good enough. Okay. What would be preceded? Preceded is a beautiful word, but generally what happens when you don't read it as precede, you read it as proceed, the absolute meaning. Precede means before, proceed means after. So you have to be very, very careful. Arun Ravi, 7, excellent. So preceded by fungal stains and culture of the lesions in the diagnostic step of rhinocerebral. Rhinocerebral is mentioned in B. So preceded, that means before. What happens? It is the punch biopsy of the lesion followed by fungal stain. So preceded by punch biopsy. So that's a two-word answer, PUNCH-BIOPSY. So in terms of infusion site concerns with nephrotoxicity, which form of amphotericin B exhibits fewer problems? So definitely where? C, isn't it? So they are talking about one particular medicine now. Mild nephrotoxicity and all those things are mentioned. So liposomal form offers less infusion side effects and milder nephrotoxicity. So the answer is liposomal, LIPOSOMAL. So what is the term for the infection fighting white blood cell variety? So where are they talking about white blood cell variety? So white blood cell variety is mentioned in A. So what is a white blood cell variety? What is it? It is called neutrophils, isn't it? So very straight answer. So it is clearly saying people with uncontrolled diabetes, people who have low levels of neutrophils, a type of white blood cell. So NEUTROPHILS is the answer. With the assistance of a head scan, which component level can be discerned? So head scan means CT or MRI. Generally, that is what the scan has been referring to. So where are they talking about MRI and so CT or MRI? Head is there. What is it revealing? Air fluid. So it's a hyphenated word. Air-fluid should be the answer. Clear? Good enough. What is the cutting-edge adjunctive therapy with a potential role in mucormycosis treatment? Again, treatment. So where is it? What is the most important thing they're talking about? So they are saying what? It is the, where are they talking about? See, iron chelation is a novel cutting-edge adjunctive therapy that has a potent role in the treatment. So what is the answer? Iron chelation, IRONCHELATION. Good enough. In the event of cut or burn, so cut or burn, where? Okay, I know where to go. How to articulate the transmission of the infection when the fungus infiltrates the skin? So what is the thing that is called when it affects the skin due to cut? So articulate means express. That's another beautiful word, articulate. Okay. So what is that? It is called the cutaneous exposure, isn't it? Cut and burn is called cutaneous. CUTANEOUSEXPOSURE. Now, question 14. What is the biological structures? What biological structures were identified in the outcome of 171 biopsies? 171 biopsy, Reshma, exposure spelling, please do check. Yeah, if it is a typo, no problem. If not, you'll lose mark. So be aware of it. So which one? So 171 biopsies is there. So which is one? Fungal hyphae. FUNGALHYPHAE. Now for the final set of questions, these are called fill in the blanks question, where the instruction remains as similar to short answer question, but redundancy should be looked into. That means you're not supposed to write any word if it is given in the text, especially an article. If it is there next to the before the word or after, you have to be very cautious with that. Okay. Dash is less severe with the liposomal form, making both conventional and liposomal amphotericin be effective in fewer infusion sites. So where? Treatment again. So it is all there. Both conventional. What is it? They're talking about the nephrotoxicity. NEPHROTOXICITY. Officially, it tends to surface more in those compromised immunity, underlying health adversities. Adversities means a lot of conditions, illness, and all those. So where are they talking? Again, go to A. So what is the one which is causing a lot of problems? So it is clearly saying, formerly known as zygomycosis, the infection tend to affect the weakened immunity, so compromised people. Okay. or illness and health condition. So health adversity is illness and condition. So �psychomycosis is we say Z, isn't it? 𝐉𝐨𝐢𝐧. In recent findings, so that means with the latest thing, something, orally administered azole demonstrated promising result, 𝐬𝐴 species with a score less than 100. So less than 100. Now where are they talking about all these? Again, treatment is it? So because it's saying 𝐬𝐴 species, 100 is there, but that is not our question. Our question is less than 100, so 99. So what is the 99 one? Orally administered. So posaconazole, POSACONAZOLE is the answer. Good enough. The infection is classified as sinus exposure upon inhaling dash in the air. So what are they inhaling? You can always go to A because it clearly says you can contract by breathing affected mold spores. MOLDSPORES. Penultimate question for today. The presence of characteristics broad branching hyphae invading the tissue is disclosed through. So how was it disclosed? So definitely diagnosis, isn't it? So characteristic branching hyphae invading the tissue, examination. Which examination? Histological examination. HISTOLOGICAL examination. That's the answer. The ultimate question for today. Successful recovery was experienced by DASH patient treated with antifungals based on high suspicion from imaging. So where are they talking about all these? So they are saying imaging, high suspension, antifungal. So how many patients? 3. It's number 3 is the answer. So I have finished all the 20. It's high time that you tell me what are your total scores, or if you have any doubt with regards to any of those answers, you're always welcome to clarify it. Ivira, okay, good enough, good enough. So anybody with any doubt with regards to any of those questions, please do clarify. If not, do shoot your total scores. 18 Reshma, good enough. Keep it up. Maria, 20 out of 20. Absolutely good enough. Excellent. Keep it up. Keep it up. Just small 15. Very, very good. Keep it up. See, why? You have to appreciate what you have got, isn't it? Not about what others have got. Atira, 20. Absolutely stunning. Keep it up. Keep it up. Good, good, good. See, your ability to accept that mistake is your learning curve. You have to take it from there. Ivira 19 in 13 minutes, absolutely good enough. Kalyani 18, good enough, good enough. Keep it up, keep it up. Arun Ravi 15, excellent, good enough, keep it up. Lini Siju 17, good enough, keep it up. Kalai 18, good enough, absolutely good enough. And this is your last time that you're going to do the material, isn't it? Because you have made it to your dream. Keep it up. Reshma, thank you. Beulah 17, good. Right, because I couldn't see anybody having any doubts. Okay, Kalyani, thank you. Kalyani, I've started saying thank you. So it's high time that I'll take a leave as well from all of you. And once again, thank you very much for those 2 people who have made it to their dream, Kalai and Neetu. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.